Question 1. A nurse is caring for a patient with severe plaque psoriasis who is scheduled for phototherapy. What is the nurse's priority teaching before the procedure? A. Apply emollient immediately before the session. B. Wear protective eyewear during the procedure. C. Expose unaffected skin for even results. D. Increase fluid intake post-procedure. Answer. B. Wear protective eyewear during the procedure. Question 2. Which patient with psoriasis requires immediate assessment by the nurse? A. Reports thick silver scales on the elbows. B. Complains of joint stiffness in the morning. C. Has widespread redness, peeling, and fever. D. Has mild itching around existing plaques. Answer. C. Has widespread redness, peeling, and fever. Question 3. A patient with psoriasis is prescribed methotrexate. Which task can the nurse delegate to the LPN? A. Monitor liver function tests. B. Teach the patient to avoid alcohol. C. Assess for oral ulcers or mouth pain. D. Administer the prescribed methotrexate. Answer. D. Administer the prescribed methotrexate. Question 4. A patient with psoriasis develops signs of depression. What is the nurse's best action? A. Refer to a dermatologist. B. Encourage use of skin ointments. C. Notify the healthcare provider immediately. D. Recommend group therapy online. Answer. C. Notify the healthcare provider immediately. Question 5. A nurse notes thick plaques and fissures on a psoriasis patient's hands. What intervention should be implemented first? A. Apply gloves to prevent infection. B. Report findings to infection control. C. Encourage patient to use hand lotion. D. Wash hands with warm water and gentle cleanser. Answer. D. Wash hands with warm water and gentle cleanser. Question 6. A patient on biologic therapy for psoriasis reports a mild sore throat. What is the nurse's priority action? A. Encourage warm saline gargles. B. Discontinue the biologic medication. C. Notify the healthcare provider. D. Monitor the patient's temperature. Answer. C. Notify the healthcare provider. Question 7. Which intervention should the nurse delegate to a UAP for a patient with stable psoriasis? A. Apply medicated topical cream. B. Perform a skin assessment. C. Assist with a tepid bath. D. Educate about phototherapy risks. Answer. C. Assist with a tepid bath. Question 8. A nurse is preparing discharge instructions for a patient with psoriasis. Which statement requires correction? A. I will keep my skin moisturized daily. B. I'll use a humidifier in the winter. C. I can stop my medications once the rash clears. D. I will avoid scratching my plaques. Answer. C. I can stop my medications once the rash clears. Question 9. A psoriasis patient is being treated with cyclosporin. Which finding is most concerning? A. Blood pressure of 158/92 mmHg. B. Creatinine level of 1.1 milligrams per deciliter. C. Occasional headache. D. Mild gingival hyperplasia. Answer. A. Blood pressure of 158/92 mmHg. Question 10. A newly admitted patient has pustular psoriasis with systemic symptoms. What is the priority nursing action? A. Initiate contact precautions. B. Administer prescribed corticosteroids. C. Check the patient's temperature. D. Apply soothing emollients. Answer. C. Check the patient's temperature. Question 11. Which dietary instruction is most appropriate for a patient with psoriasis? A. Increase your intake of spicy food. B. Consume high-protein, low-fat meals. C. Avoid dairy and all citrus fruits. D. limit intake of whole grains. Answer B. Consume high-protein, low-fat meals. Question 12. A patient with psoriatic arthritis reports worsening joint pain. What is the nurse's best response? A. Try applying cold compresses to your joints. B. Let's schedule another phototherapy session. C. You should rest and avoid movement. D. I'll notify your provider about the pain. Answer D. I'll notify your provider about the pain. Question 13. A nurse evaluates a patient using coal tar for psoriasis. Which nursing action is most appropriate? A. Monitor for photosensitivity. B. Instruct to apply it to open wounds. C. Recommend daily application on face. D. Encourage mixing with steroid cream. Answer A. Monitor for photosensitivity. Question 14. A nurse is reviewing lab results of a patient on systemic corticosteroids for psoriasis. Which lab value is most important to report? A. Glucose level of 186 milligrams per deciliter. B. Potassium level of 3.2 milliequivalent/L. C. Hemoglobin level of 14G/DL. D. Platelet count of 200,000/mm superscript 3. Answer B. Potassium level of 3.2 milliequivalent/L. Question 15. A psoriasis patient expresses concern about how their appearance affects work. What is the most therapeutic response? A. You should not worry about what people think. B. There are worse things than psoriasis. C. Tell me more about how it affects you. D. Try wearing long sleeves to cover it. Answer C. Tell me more about how it affects you. Question 16. A patient with psoriasis is prescribed a topical corticosteroid. What instruction is essential? A. Apply the cream thickly for deeper absorption. B. Use it only when plaques are bleeding. C. Use a thin layer over affected areas. D. Apply it right before phototherapy. Answer C. Use a thin layer over affected areas. Question 17. A patient undergoing UVB therapy for psoriasis asks about side effects. What should the nurse emphasize? A. It may cause temporary weight gain. B. You might experience mild nausea. C. Skin redness is a common reaction. D. It increases blood pressure significantly. Answer C. Skin redness is a common reaction. Question 18. A nurse evaluates the effectiveness of treatment for a psoriasis patient. What findings suggest improvement? A. New red patches on scalp. B. Absence of pruritus. C. Reports of fatigue. D. Increased scaling on plaques. Answer B. Absence of pruritus. Question 19. Which patient statement indicates a misunderstanding of psoriasis care? A. I know stress can make it worse. B. I'll avoid harsh soaps. C. It's contagious if untreated. D. I'll avoid long hot showers. Answer C. It's contagious if untreated. Question 20. A patient with psoriasis is started on a biologic agent. Which assessment is a priority before initiating therapy? A. History of fungal skin infections. B. Recent use of topical steroids. C. Presence of dental caries. D. History of tuberculosis. Answer D. History of tuberculosis. Question 21. A patient with psoriasis is prescribed etanercept. Which statement by the patient requires further teaching? A. I will inject this medication under the skin. B. I should avoid live vaccines while on this drug. C. This drug may make me more prone to infections. D. I can take this medication even when I have the flu. Answer D. I can take this medication even when I have the flu. Question 22. Which nursing intervention is most appropriate for a psoriasis patient complaining of dry, cracked skin? A. Apply alcohol-based lotion twice daily. B. Encourage long hot showers to soften skin. C. Apply thick emollients immediately after bathing. D. Advise air drying the skin after bathing. Answer: C. Apply thick emollients immediately after bathing. Question 23. A nurse is assessing a patient with inverse psoriasis. Which location is most consistent with this diagnosis? A. Knees and elbows. B. Scalp and face. C. Groin and axilla. D. Palms and soles. Answer: C. Groin and axilla. Question 24. A nurse is caring for a patient with psoriatic arthritis taking NSAIDs. Which symptom is most concerning? A. Mild ankle swelling. B. Tarry black stools. C. Increased appetite. D. Occasional headache. Answer: B. Tarry black stools. Question 25. Which task can the nurse delegate to an LPN caring for a stable psoriasis patient? A. Teaching the patient about biologic therapy. B. Documenting therapeutic response to methotrexate. C. Assessing the patient for signs of infection. D. Reinforcing phototherapy preparation steps. Answer: D. Reinforcing phototherapy preparation steps. Question 26. A patient with erythrodermic psoriasis presents with chills and hypotension. What is the nurse's first action? A. Check the patient's blood glucose. B. Initiate intravenous fluid therapy. C. Apply warming blankets. D. Notify infection control. Answer: B. Initiate intravenous fluid therapy. Question 27. A nurse finds a psoriasis patient emotionally distressed due to body image. Which action is most therapeutic? A. Refer to a cosmetic specialist. B. Suggest avoiding mirrors. C. Offer emotional support and active listening. D. Change the topic to reduce distress. Answer: C. Offer emotional support and active listening. Question 28. Which finding would require immediate action in a patient with psoriasis receiving adalimumab? A. Red, itchy skin on lower legs. B. A new productive cough with fever. C. Mild joint pain. D. Scaling around the ears. Answer: B. A new productive cough with fever. Question 29. A nurse prepares to administer topical salicylic acid for a psoriasis patient. What safety measure is most critical? A. Apply liberally to entire body surface. B. Avoid use on the scalp. C. Use cautiously to prevent salicylate toxicity. D. Cover treated areas with plastic wrap. Answer: C. Use cautiously to prevent salicylate toxicity. Question 30. A psoriasis patient is scheduled for laser therapy. Which nursing action is essential before treatment? A. Remove all metal jewelry. B. Instruct to apply sunscreen before procedure. C. Shave the entire treatment area. D. Administer oral corticosteroids. Answer: A. Remove all metal jewelry. Question 31. A patient with psoriasis is prescribed systemic retinoids. Which instruction is most important for a female patient? A. Take this with dairy for better absorption. B. Report any muscle pain immediately. C. Use reliable contraception during and after therapy. D. Avoid taking the medication with food. Answer: C. Use reliable contraception during and after therapy. Question 32. Which outcome best indicates successful response to systemic therapy in psoriasis? A. Decreased skin hydration. B. Reduced joint mobility. C. Reduction in plaque thickness and itching. D. Increased scaling of lesions. Answer: C. Reduction in plaque thickness and itching. Question 33. A nurse is educating a psoriasis patient on avoiding triggers. Which statement indicates a need for further teaching? A. I'll reduce my alcohol intake. B. I'll try to manage my stress better. C. I'll spend more time in direct sunlight daily. D. I'll stop smoking completely. Answer: C. I'll spend more time in direct sunlight daily. Question 34. A psoriasis patient experiences worsening symptoms after discontinuing corticosteroid cream. What condition is this? A. Rebound flare. B. Superinfection. C. Hypersensitivity reaction. D. Secondary eczema. Answer: A. Rebound flare. Question 35. A nurse prepares to teach a group of psoriasis patients. Which group activity would be most appropriate? A. Sharing personal skincare routines. B. Competing for lowest stress scores. C. Self-diagnosing lesion severity. D. Comparing medical insurance coverage. Answer: A. Sharing personal skincare routines. Question 36. A nurse reviews medications for a psoriasis patient. Which medication requires monitoring for renal function? A. Methotrexate. B. Acitretin. C. Cyclosporin. D. Calcipotriene. Answer: C. Cyclosporin. Question 37. A psoriasis patient asks about complementary therapies. Which nurse response is evidence-based? A. Aloe vera may help soothe your skin. B. You should try a raw food diet. C. Apple cider vinegar will cure psoriasis. D. Avoid exercise to prevent flare-ups. Answer: A. Aloe vera may help soothe your skin. Question 38. A patient asks why their psoriasis worsened after a strep throat infection. What is the best response? A. The bacteria reduce skin hydration. B. Your immune system triggered inflammation. C. It means your medication isn't working. D. Infections block topical absorption. Answer: B. Your immune system triggered inflammation. Question 39. A nurse is caring for a psoriasis patient who reports eye dryness and blurry vision. What is the nurse's next action? A. Document and reassess in 8 hours. B. Ask about recent use of biologic agents. C. Recommend using cold compresses. D. Advise lubricating drops and continue monitoring. Answer: B. Ask about recent use of biologic agents. Question 40. A patient on long-term corticosteroids for psoriasis suddenly stops the medication. What is the greatest risk? A. New plaque formation. B. Hypertensive crisis. C. Adrenal insufficiency. D. Drug resistance. Answer: C. Adrenal insufficiency. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.